This is a case study that we're doing with the lovely Nancy. We've been working through specifically distance sessions for the last month and a half, integrating purely static response points as well as the movement flows. Nancy to date has only had the one movement flow that she's been working with, specifically in relation to what has come through for the priority of session. Here in the side aspect, we're going to have a look at the right side aspect. The photo on the left hand side is the before photo, and the photo on the right hand side is the after photo, or the photo that is most appropriate and current in relation to Nancy's bodily expressional state of being. The photo on the left and in comparison to the right, you will be noticing very distinct changes or differences on first view, but we are going to go through the photos in a little bit more detail. This photo specifically, I'm going to work more with the Chinese element approach in relation to the musculature positioning of the different elements, their emotions, the meridian influences, emotional influences, and then also working slightly into the archetypes of the different elements where it is applicable, and then obviously highlighting any specific links or information that will be useful in relation to how we've been working with Nancy's sessions, taking consideration her physical, emotional, mental state of being. Here in the photos, I've just included the basic grid lines or postural analysis gridding to give me a clearer identification of her physical structure in relation to the center line, anything that is leaning away or leaning towards or angling in or out of the midline. It's just a really lovely way to get your eye focused in on all the photos, and then it also gives you a really nice start point as to the most noticeable aspects that we would like to work with. So in relation to the before photo, we're going to just start identifying specific areas that show up quite distinctly. So here we've got, and it was actually one of Nancy's main physiological or structural concerns that we started focusing the session on, really compromised structural positioning and support within the within the spine, specifically from a vertebral aspect, leading to a lot of pain and discomfort. So when we have a look at the two arcs of the back, we're looking at a really strong curvature in the upper thoracic, almost impinging into the lumbar aspect of the spine, and then again a very curved position hooking in underneath the sit bone there of the spine, and that will obviously compromise into the coccyx and reciprocate up into the cervical spine influence. So you'll see the angle on the back aspect of the legs or hamstrings is really strong in relation to the after photo where the angle is not so strong. We're looking here at the before photo where the thumb of the hand is tucked in toward the body, exposing the pinky finger quite extremely, and then again this has evened out and opened up that shoulder joint to open up the arm so that the palm can be more rested against the body. The left or before photo, you're looking at a really strong protracted shoulder, suggesting that there's quite a strong contraction through that pectoral muscle, creating a lot of tension across the sternum. After photo demonstrating how we've managed to open the shoulder, creating a more relaxed and stretched aspect through the sternum. Here along the diaphragm line, you will see a very distinct change in the angling of that diaphragm. The back has opened up beautifully and lengthened through that upper thoracic, allowing the diaphragm to relax into its positional and optimal state of being, which is more of a horizontal parallel to the floor position, to encourage full inhalation and exhalation. Again, in specific to the malleolus or the ankle joint, we're looking at really strong curvatures in the before photo and a little bit more relaxed in the after photo. And there I've shown you a specific focus on the hand position. in relation to the armpit or the pectoral, which will come down into influence into that elbow joint or crease, which has created a really deep connection through that forearm in the before photo, which will rotate that arm inwards. This will compromise specifically into lung meridian, which runs along the inside of the arm. It will compromise into small intestine, heart and triple heater meridians, which interlace across quite a few of the meridians. So we're looking at quite a strong elemental influence on that body. Lung meridian being specifically related to the metal aspect or the metal element, and here in relation to the physical presentation of the body. The before photo with Nancy, we're seeing a really strong connection and almost a torsion pull through that neck and sternocleido, which is hooking into the back of the ear, which will be directly influenced or affecting into that small intestine. Gallbladder will run along there as well. The tension and the clear description or the clear presentation there on the before photo of the TMJ that's pulling quite tight, the after photo showing the nice relaxed comparison. Eyes on the before photo really small and tightly knitted in terms of pressure and tension, and then on the after photo giving you a really nice idea as to how they have relaxed. Now the TMJ will reciprocate specifically into the SIJ, so if there is a lot of tension in that jaw muscle, it is going to cause quite a bit of a pull into the sacroiliac joint, often creating a craniosacral jam, and then that will relate into the sinus and the sphenoid being jammed, which will, as a secondary function or effect, affect her breathing capacity in terms of inhalation or exhalation. Here at the others, I've shown you quite a clear, almost compression of pressure. So she's leaning in and upwards with the hips and down and inwards with the upper torso, creating quite a heavy pressure influence onto the center aspects of the body into that spine, which will compromise the start of the lower thoracic and the upper lumbar curvatures of the spine quite a bit. Almost disengaging the abdominal and core influences. On the after photo, you can see a really nice even distribution of weight, lifting up and out of the legs towards the ceiling and connecting down towards the floor through the upper torso, creating a really even tension balance through both aspects of the body, top and bottom, in terms of the planes that are divided through the abdomen, middle, center. So that will be a really good support for her in terms of showing that the core is nicely connected. So here we're going to go into the frontal aspect, specifically related to the stomach meridian that runs through here. The spleen meridian runs across the front side of the body. So we've got a lot of digestive processes that are being influenced here through the sharp curvature along that front aspect of the legs. From a musculature positioning, the quadriceps are specifically related to the fire element, bringing in the small intestine and heart meridian influence there. Also the fire element in terms of having the passion to move forward and connect deeply into your awareness. And then onto the shin bone, we've got the peroneus, which is connected into the water element. A lot of emotional influences there, which can create a bit of a stagnation if there is over-connection or compromisation into that muscle. Into the shoulder joint, you got quite a strong protraction of that muscle. The anterior deltoid specifically related into the wood element. Wood element is all about the change and new life, and the archetype of the pioneer, being open to express and move forward in life. Also directly related to the body areas that are governed in relation to the muscles, tendons, ligaments, etc. The curvature on the back, specifically relating to the lower thoracic aspects of the spine. Here we're going to be looking specifically at kidneys, the bladder influences, adrenal influences, small intestine, lymphatic circulation will be affected. On the after photo, we're looking at a much softer curvature. dulled positioning of the glutes in relation to the before and after. The after photo, you'll see that the glutes have started plumping out quite nicely. This, in the energy medicine aspect, we look at the spleen chi. If there is a very flat bottom or glute presentation, we look at quite a deficiency through the spleen chi. Spleen relating specifically into the earth element in relation to the nourishing of the body, the subconscious mind, the intuitive processing, and then directly relating into the consciousness of essence and primary sense of being. So the natural emotion, we want to help the role generate nourishment in the body. In relation to the neck and the head, we've got a lot of in the before photo, tightening up along the cranium, the back of the ear, the neck, into the shoulder. So that is all related in terms of the gallbladder meridian. We're looking at small intestine influence. It will come through into the face in relation to the small intestine, which can compromise into a cranial jam. So looking at just getting a bit of movement through that intestinal space or the small intestine, opening up the TMJ of that jaw muscle in relation to the SIJ to get nice reciprocation into the hips. We're looking also at the meridian coming through, which is part of the deep integrated fascial zones that we work with in terms of deep core stability coming through from the armpit into the frontal aspects of the pelvis, and then again from the pelvis, which will feed through the inguinal space into the legs in terms of stability, internal and external hip stability, and that directly relates into the internal and external impact of the piriformis muscle. Piriformis muscle being specifically a fire element, musculature positioning, looking at expansion, intellect and awareness, also looking at wisdom, knowing, spirit, the balancing of the joy and sadness in our life's expressions. Here in the before photo with all the circles along the spinal positions, we're specifically relating here to the triple heater meridian. Triple heater meridian, we're looking at a time zone of 9 p.m. until 11 p.m. Working with the keywords specifically of fascia and transition. It's a very yang orientated meridian. It runs into the arms, along the forearms, into the ring finger. So we're looking at a really deep aspect of upper trap influence into the back of the cranium, the back of cervical spine. So it's a really, really powerful and influential meridian with zoning influence all the way along the spine. So this is definitely one that you want to try and work through a lot of spinal articulation and awareness. Here we're going to go through into the stabilizers. So the fascial stabilizers, we look at specific lines that create an X or a crisscross in terms of relating to a three-dimensional and essentially an interdimensional stability creation that creates front, back, side, top, bottom stability to allow the body a very well-functioning rotational system. So when that body rotates and works with extension, flexion, lateral extension, flexion, etc., we really fully support it through that system. So highlighting into these fascial stabilizers, here I've highlighted the fascial stabilizers that for Nancy's position and body awareness were not in fact connecting or communicating with each other correctly. So we were creating a lot of posterior push into the anterior aspect of the body, which essentially disengages the abs. It overuses incorrect muscles, and it leads to postural alignment that goes out, and then it deeply impacts into the deeper aspects of the body. So we've got torso, hips, upper leg, lower leg. We've got a specific fascial stabilizer compromised on the forearm in relation to that arm position, the shoulders, the upper shoulder in relation to the deltoid position. Here we've got in from the clavicle into the cranium, the TMJ into the back aspects of the upper shoulders. The cranium here is really tight in relation to that jawline. So there are quite a few stabilizers here that we really needed to get activated and moving and connected. The after photo we're showing just the fascial stabilizers that we're still working with in relation to the main crisscross and more of a reciprocal fascial stabilization through the clavicle to opposite hip. Also still working the clavicle up into the back of the cranium, making sure that the cranium relates specifically into the TMJ, so the TMJ reciprocates through into the SIJ and just holds the stabilization through the cranial sacral relationship. Here again working specifically along that jaw to work into the top of the cranium, allowing the sagittal plane sinus in the cranium to integrate and to just function a little bit more easily within the body. We still want to work into the upper leg stabilizer here, working specifically from sit bone into the knees, into the frontal aspect and inner aspects of the pelvis, working more towards actually in the gallbladder meridian, which runs along the lateral aspects of the body, to allow a more of a movement orientated response in the body, bringing in the liver aspects, so again balancing into the yin yang aspects of the liver and gallbladder. Here they work specifically with keywords such as the hinge, discernment, filters, synchronization, specifically into the liver. We work with the feminine cycle here. We work with emotional processing. So it's a very, very important meridian to work with there. If the liver is out, generally there are a lot of body processes that don't work so well, and you cannot function with the planning and decision making, so it's a lovely one to incorporate. Here we're looking at the reciprocals. So now I showed you on the side of the body, but essentially with the reciprocals we work with opposites. So the ankle or malleolus we link with the wrist, so opposite sides. Knees, we work with the elbow positionings, and essentially the ankle consciousness is how you are stabilized in your environments through in life in general. Knees are very much about powering yourself forward. We look at the fear response to life. We look at the emotional stability. We look very much at kidney influence and bladder influence here from the emotional aspects. Wrists are all about hanging on and managing to work with things in your life, or if things are too difficult to hold on to or work. And then we're looking at the TMJ in relation to the sacroiliac joint, the zygoma on the cheekbone linking through into the pubis. Here we're going to link the inguinal tendon through into the clavicle, so that will definitely be part of the fascial cross of the frontal aspects of the body in terms of a fascial stabilizer that we work with. And also the front of the body is very much about how you move forward in life. Back of the body, how we're able to hold ourselves up, what backbone we have, how we feel moving away from our past in relation to integrating our experiences into the future. How are you, do you have your own back, that kind of concept. Here we're looking at the cervical spine in relation to the base